My name is Dr. Warren Wulff. I'm an orthopedic surgeon here in Syracuse, New York. I'm part of a very large orthopedic group called Syracuse Orthopedic Specialists. I've studied all over, most recently here, right here in Syracuse, which is where I did my residency training in orthopedic surgery at the Upstate Hospital. That was about 12 years ago. After that, I did what's called a fellowship, an extra training program in spine surgery, and that was in various hospitals around Boston. And prior to all that, I was actually a mechanical engineer. I went to engineering school down at Cornell and was involved in the design and manufacturing of orthopedic implants, of prosthetics. So I came to orthopedics from what may seem like a fairly roundabout way, but in fact that's a common pathway to get here. A lot of orthopedic surgeons have backgrounds in mechanical engineering or even sports and converge on orthopedics as a career from those experiences. I came to Syracuse to do the orthopedic training there because the orthopedic training program at Upstate University in Syracuse has traditionally been excellent. It's one of the top programs, and so I was very fortunate to have come to Syracuse for that. And while in the program, you're there for 5 years, and you get to experience working at all the different regional hospitals. You get to experience working with the different regional groups and the different physicians as an apprentice, essentially. And it's during that time that you forge the relationships with the hospitals, with other surgeons, with the nurses, with the OR staff. And it became very clear to me at that point that St. Joseph's was a great match for me. I really enjoyed very much working with the people there. I had mentors there. The hospital facilities were excellent, and it was one of the favorite parts of my training. The nice thing about St. Joseph's Hospital is they have the capacity to handle anything that's thrown their way. You can get cardiology consultations, you can get neurology consultations, you can get urology consultations. Ear, nose, and throat, anybody you need is available. And it's very comforting for me to be there knowing that should one of my patients get into trouble, they have it covered. With experience and with volume comes safety and proficiency, but more importantly, again, the ability to handle what fate throws your way, and you have to be able to get through it safely for the benefit of the patient. As a patient, you've entrusted yourself to the hands of your surgeon. You need to have faith in where the surgeon is taking you. You need to believe that the surgeon is taking you to the hospital where he or she feels most comfortable doing your procedure. And the patient needs to know that the decisions that I'm making based on my experience and my training are for their best interest. And if that means taking the patient to St. Joseph's, where I feel comfortable, surrounded by colleagues who I know are there to help, then the patient has to give that trust. And I think once the physician-patient trusting relationship has been established, then nothing else matters.